Hi, everyone. I'm Jessie Young. I'm the chair of the research committee for the ACA Pediatrics Council, and I'm here today to talk about our Pediatric Research Fund and our efforts in crowdsourcing donations for pediatric research projects. And our first project that we have going is Dr. Pullman's course project, a longitudinal study that is observational follow-up and risk study for adolescents or school-age children with back pain or spinal pain in general. And I've shared the project link, video, and donation links below, so take a minute to check that out when you can. Our donations of any amount will help. Our largest donation so far has been $300, but even a donation of $5 helps us reach our goal. And in January, all of the donations that are made will be entered into a raffle to win a book, The Evidence-Based Chiropractic Care for Infants, written by Dr. Joyce Miller. And with me today to talk about her book and the motivation for writing this is Dr. Miller herself. And your work is what sparked my interest in pediatrics and breastfeeding, which led to me to get my IBS-CLC and completely changed the way that I practiced and that I currently practice. And we share a lot of common interests of infant care, breastfeeding, research and education. So I'm very excited to finally meet you. And thank you so much for chatting with us today.
Thank you, Jessie. And I'm very excited to meet you because it's the young doctors like you who are our future. So thank you for your interest and bringing the intersection of research and practice together, because that's how we make progress and begin to flourish in our profession.
Yes, absolutely. I'd love for you to start by talking a bit about your focus on neonate and infant care and specifically the interdisciplinary clinic, breastfeeding clinic you created at AECC College in England.
Well, yeah, Jess, I could talk about this all day. I'll have to be brief. The population of neonates and infants came to us at AECC Clinic. We have a, I worked in the clinic structure at Northwestern before I went abroad to AECC, and it turns out that the babies just started flowing into our practice, and we needed to take care of them because, of course, infants, for any professional who practices with children, infants are the largest population. Most likely because they've had a difficult birth. New parents don't know, they're frightened, they don't quite know how to manage the baby. They've got sleep problems, crying problems, feeding problems, so they come in. And we needed to set the stage to manage those problems. And we had a very large clinic. We saw about 60,000 patients a year, and in the university clinic, and about 10 to 12,000 of those were children. So had a fairly decent number. And when you have those kind of numbers, you can actually do research.
Yeah.
And of course, that's what we need. We need research. And the first couple of studies I did were on crying babies, because that's a huge problem in the population. And then we started to see that the midwives, the pediatricians, the people who saw the babies first very early in their lives, the neonate, even, same 1 to 2 days old, were having feeding problems. And that was why when I was talking one day to a group of midwives in the hospital, and one of the midwives came up afterwards and said, I have this crazy idea. Why don't we practice together and see what we can do? And I said, that's funny, because I had almost exactly that same crazy idea, and trying to figure out which one of these midwives could I dare talk to about this. And so within a few months, we had opened an interdisciplinary dedicated breastfeeding clinic as an adjunct to our routine clinical care. And it was, I have to say, one of the most gratifying experiences I've ever had in my life. And we opened it in 2012. It's would be still operational, except that it closed through COVID because of the difficulties of that. And so we had visitors from all over the world because it was fairly unique. It's not the first time this is ever done, but it's fairly unique. And then we've had other places in Norway, for example, where they have opened clinics like this as well. And it's a wonderful service for the mothers and babies. In one study that we did, a service evaluation, we found that infants who had been through our care were 4 times as likely to be able to continue breastfeeding as those who were not. So the results were good.
Yeah. Wonderful, wonderful. And what advice can you give on building those professional relationships, and why are they so important to our profession?
Well, they are the key simply because it's patient-centered care. And patient-centered care is all about getting the best person to work with the patient, whoever it is, whatever their age is, at the right time. And it happens in breastfeeding. It's almost essential to have the 2 professions together. I mean, you yourself, Jessie, have put together chiropractic and the lactation consultant degrees so that you can be 2 for 1. Very few people have that amount of energy and willingness to do that. But so we brought the professions together. And in fact, we tried to bring in lactation consultants. There are very few lactation consultants in the UK compared to midwives. Midwives are commonly the person who deals with teaching the mother how to breastfeed. So in our interdisciplinary office, the midwifery team literally taught the mother and the baby, if they could, and the chiropractic team analyzed what is the problem, why can't the baby feed? And of course, almost always it's a biomechanical artifact from either intrauterine constraint or from a difficult birth. And so together, and you know yourself, Jessie, you can solve these problems almost instantaneously. And that's what's so gratifying for the family. And of course, the minute that mother goes back to her GP or pediatrician or whoever, and if she wasn't sent by them, she says, well, why didn't you send me? Because this really worked. And then the next time they send the next person in. So we had it was a very large referral practice, but of course it takes time to grow that. But all of us who are interested in children, we know that it's the parents who drive the care, because they will not stop until they find some help for their child, and more power to them.
Yeah, absolutely. And we talked a bit about this earlier. How do you see the role of advice for students or general practitioners and the role of the pediatric specialist, the chiropractic pediatric specialist?
Well, it is very important because we're all well aware, especially if you had a baby come to you and you didn't know how to handle it, that children are not small adults, that it takes a completely different set of skills, including understanding what their heart rate should be, what the respiratory rate should be, looking at the full care of the child is very different than looking at the care of the adult. Now, children, of course, do have musculoskeletal problems, and this is very obvious. And of course, we're musculoskeletal. We can treat this. We're actually, I'm pretty sure, more than likely better at this than most healthcare professionals who haven't really paid attention to the musculoskeletal aberrations in particularly the newborn. In fact, there's good research that shows that the medical practice would prefer to have someone else manage these children because they really don't, it's not their specialty. They're looking at life and death, let's face it. I mean, that's if that child is in a life and death situation, believe me, I don't want to handle it. I want to send them off to the medics. But if that child is in a quality of life situation where they're having pain, discomfort, difficulties with their activities of daily living, such as being able to sleep on their back, which we know is a huge problem and actually can be a life and death problem because of the risk for sudden infant death syndrome, well, chiropractors can help that. But of course, we need to have the specialized knowledge to be able to understand the problem and deal with it appropriately and describe it appropriately to the parents so that they understand what it is, what we're going to do. And of course, we need a profound knowledge of the safety. Fortunately, we have an excellent safety record. And we have to understand the mechanism of why this is working in the child. So we can explain it not just to the parent, but more than likely to the doctor as well. Because if they particularly sent them in, we want to be able to tell them, and they're curious, terribly curious. Well, what did you do? I looked at that baby. There was nothing wrong with that baby. I have had pediatricians who are parents in my office looking at the baby saying, we don't know why we're bringing you this baby because there's nothing wrong with this baby other than the fact that he screams all the time. And then I'll say, well, did you ever notice his posture? And the mother will break down crying and saying, I didn't see it. Because of course, it's a different set of skills. It's perfectly normal. We don't recognize other problems that other clinicians will recognize. Why should they recognize ours and our specialty? So there's a definite niche for a strong pediatric practice in chiropractic care, but I feel that chiropractors have not availed themselves of the education to fill that niche. And that, of course, is a requirement. I know that you have, Jessie, and I know that many others have, but there are many others who think, well, that's simple. But in fact, it's quite complex. It's a complex group of patients.
You write, absolutely. You write
so
wonderfully in this book.
To describe, interpret, investigate, explain what we're doing, how we're doing it, why we're doing it, and what the evidence is. And the evidence is not as good as it should be, but we are not without evidence. We have reasonable evidence, and we have evidence for three very important factors. Satisfaction. Parents are highly satisfied with our care, and that is the new goal of healthcare. Cost effectiveness, another big goal of healthcare right now, and safety. And okay, we put those three together: safety, cost effectiveness, parental satisfaction, and those are very good goals, and you can read the research for yourself. It's there. And it'd be good to tell
absolutely.
people about
breastfeeding.
And breastfeeding, of course. Breastfeeding, hugely important. You have a big part of your practice is breastfeeding babies, isn't it? Or difficulty issues with breastfeeding issues.
Yeah, all of my patients have difficulty breastfeeding, and just the public health impact of improving a child's breastfeeding long-term health is just why I love doing it and why I got so interested in it. And then with, something like public health wise with breastfeeding and low back pain, chiropractors, that's what we do. Those two problems are huge issues, and we have the solutions. So getting that education, and you're also getting the literature into the hands of the doctors is another thing I'd like to talk with you about. And this is another area of expertise for you, is in education. And you are a professor at AECC, teaching undergraduate courses in pediatric and evidence-based care, as well as a master's program in musculoskeletal health of pediatrics. So can you talk about that a bit? Maybe some advice for students interested or general practitioners interested in learning more?
Well, you can have all the evidence in the world, and if we don't use it, it doesn't matter. And of course, our pillars of patient-centered healthcare is the evidence, but it's also the doctor's opinion and the patient's opinion. So we have to put those three together, and that's what we do in our education, both in undergraduate and in the advanced courses in the master's degree as well. And students really get so motivated by this. They catch it right away how important the research is. And one of the things that I have done in my career is actually guided the research of many students who have done their own research, and they have been published very often in the Journal of Chiropractic Clinical Pediatrics, because that's a good venue, a good place for students to put their research. And anyone who's not reading that journal needs to sign on right away. It's open access. It's completely free of charge. It's on your computer with a click, and very important to see what our profession is doing, and particularly what our students are doing. And so, and I recommend that all clinicians get involved in some kind of research, and that's usually when they check out. But we have developed outcomes forms that are simple and easy to use, very basic, straightforward research. We've done practice-based research, collaborating with clinicians in their own practice. So it's, I really suggest that the average clinician, if you're really, if you're interested in your pediatric patients, of course, nothing's more interesting than what their outcomes is. And it doesn't matter what we think the outcome is. It only matters what the parent or the patient thinks the outcome is. And that's why we used patient-reported outcomes. And that's why we developed a specific patient-reported outcome for the infant patient, and found that our care is very successful. So it's, anybody can get involved. And I know it seems like it's big and it's difficult, but actually just go to a conference, go to a seminar about research, and get going. I can show you how.
That's really, thank you. Yes. It's really the main goal of the research committee that was put together by the Pediatrics Council. And for me personally, I knew it was important. I'm not a researcher, trained researcher. I'm not a writer. And how can I help?
Either.
How could I? Yeah. What can you do? And there's so many different ways to support literature. Like, you don't have to be doing the trials and writing the papers. Like, we're giving this opportunity. Maybe your contribution to the pediatric literature is, a donation made to help fund that, or there's so many opportunities. And obviously reading the literature is important, but also, finding ways that you can support it is important for our patients and our profession just in general.
That's so true. It's going back a while now, but our randomized controlled trial in infant colic, which Cochrane said, which they gave honorable mention to our trial because it was so innovative how we did it. And we couldn't fund it because that's always the problem. And I was out speaking. I spoke to the British Columbia Chiropractic Association, which isn't very far from you, just a little bit north. And they said, well, we can't fund the whole study because, of course, it takes millions to run an RCT, but we can give you $12,000. And I said, well, thank you. I'll be thrilled with that. And do you know that we ran that entire study on what they gave us? Wow. And we got Tomy Toy Company involved because I had designed a wearable baby outfit for them, which got the Parent of the Year award. So they were thrilled. They gave us all the toys for the babies. So between that, just asking, between those two, we funded our entire trial, and I hope everybody's read it because it was good. There were good results, and so it doesn't have to be. We're not talking millions here. We're talking small stuff. We could do a sleep study right now that would cost very little, and is the number one thing that bothers parents is once they can feed, they want to know why they don't sleep. So we can do this. I get really excited, Jessie, about this because I have seen the potential. I've seen how wonderful it is to watch the students work and their interest and their motivation, and the young doctors. And we can go forward. We can do this.
Absolutely. So much, and so much. There's so much that can be done with the handful of pediatric researchers we have in chiropractic are phenomenal. We just need our colleagues to support it.
Mm-hmm. That's right. We just need to do it, like Nike says.
Yes, there you go. There you go. What do you think that we should look for in continuing education? Or look out for, maybe things to avoid, things to look for in pediatrics, specifically our continuing education courses that we're taking?
Oh, I wasn't expecting a question like that, but of course, I think you should only look for evidence-based work. I would stay away from technique-driven work because children aren't suffering from a lack of technique. They're suffering from a lack of ability to move and synchronize their movements in a way that is responsive to their central nervous system. And we can manage that. I would look for people who have been in real practice, as well as I really think somebody who's done some research. And I like to think that when clinicianship and research come together, you really start to get big dividends. So it's hard to say be more specific than that, but I would be very critical, because that's what we as clinicians are meant to do, is be critical thinkers about where we should put our hard-earned money to increase our educational advantage. And of course, continuous learning is what we always do and what we always want to do.
Yeah, definitely. Do you have anything else you'd like to talk about your book in particular?
Well, I would just say about my little book this. It's about, I'm really not trying to promote my book. I'm trying to promote the evidence that it's based on. The reason I wrote the book is because I wanted to distill everything, and you can see it's tiny. It's tiny, tiny. I wanted to distill it down to as little as we could say, and yet have all the research there. There's 200 references in that book. Now, you can go and read all 200, and I recommend that you do. And I recommend that you don't believe me, that in fact you do read those references. But for busy clinicians who can't do that, and I have to always remind myself, that's who I am, basically. I was a clinician for 25 years, and then I had used to have people come and say, you should do research. And I said, no, I'm a doctor. I'm not a researcher. I can't do that. And I realized much later how wrong I was, that every doctor is a researcher. Mm-hmm. We're doing research all day long. We're always looking up, well, what is the best treatment for this? What's the sequelae of that problem? Is that patient at risk for stroke? Is there anything new in the literature that I'm not aware of, that I need to be aware of? And what are the causes of apnea in a baby? What are the signs of apnea in a baby? What is the sequelae of this? So we're always doing research. And so I'm sorry that I shied away from it in my early career, but it took me well to cotton on. But at my heart, I am a clinician. I am not a researcher. I'm not a teacher. I'm actually a clinician, which of course, we're all three. We're all clinicians, we're all researchers, and we're all teachers, because that is the nature of being a clinician. Mm-hmm. So I wrote it to help people see what's there, understand what's there, and so they don't have to read it themselves, but they can, because all the references are there, and they don't have to take my word for it. They can read the original research.
Yeah. Wonderful. Well, thank you so much. I really appreciate your time and everything you have to offer the profession. Thank you so much for chatting with us today.
Well, I'm so interested in young clinicians like you, so I'll be watching your career.
Ooh, no.